What happens during a stomach cancer biopsy collection? Imagine a procedure that helps doctors peek inside your stomach to find out if cancer cells are present. That's what a stomach cancer biopsy collection is all about. It usually happens during an upper endoscopy, also called a gastroscopy. During this process, a doctor inserts a long, thin, flexible tube called an endoscope through your mouth, down your throat, and into your stomach. The endoscope has a tiny camera attached, allowing the doctor to see the stomach lining clearly on a monitor. Before the procedure begins, you will likely need to fast for about 12 hours to ensure your stomach is empty. Sometimes, your doctor might ask you to stop certain medications, like blood thinners, a few days before. When it's time for the procedure, a local anesthetic spray is applied to your throat to numb it, making the experience more comfortable. You may also receive sedation through an intravenous line to help you relax and reduce any discomfort. A mouth guard might be placed to protect your teeth and keep your mouth open during the process. Once the endoscope is in place, the doctor carefully examines your stomach lining for any suspicious or abnormal areas. To improve visibility and access, the stomach is gently inflated with air. Using tiny tools passed through the endoscope, such as forceps or brushes, the doctor collects small tissue samples from these areas. The biopsy samples are usually very small, about the size of a grain of rice, and the entire process of collecting them takes only a few minutes within the overall procedure that lasts about 15 to 20 minutes. After the tissue is collected, the endoscope is slowly removed, and you might experience mild sore throat, bloating, or gas from the air used to inflate your stomach. These symptoms are temporary and typically go away quickly. Most people are able to go home the same day. The tissue samples are sent to a laboratory where pathologists examine them under a microscope to check for cancer cells. Results usually take up to 2 weeks, and your healthcare provider will discuss what they find and the next steps. In some cases, if the doctor suspects cancer has spread beyond the stomach, they might perform additional procedures like image-guided needle biopsies. These involve using imaging techniques such as CORT scans or endoscopic ultrasound to guide a needle through the skin or stomach wall to collect tissue from lymph nodes or other areas. These procedures also use local anesthesia and are performed with care to minimize risks. Speaking of risks, stomach biopsies are generally safe, but like any medical procedure, they carry a small chance of complications. These can include bleeding, a small perforation or hole in the stomach or esophagus, or reactions to sedatives. If you experience severe pain, difficulty breathing, or heavy bleeding afterward, seek medical help immediately. Overall, a stomach cancer biopsy is a vital step in diagnosing and understanding stomach cancer. It helps doctors determine whether cancer is present and how advanced it might be, guiding the best treatment options. Remember, always consult your healthcare provider for personalized advice and to discuss any concerns about the procedure.